50-year-old female, an active person, has a very distinct blow drying the hair limitation and kind of recreation of worsening symptoms when she does that, and that elbow to hand kind of plank push-up. 6 weeks history, lifting a heavy patient. So there was an incident. There was an actual mechanism of injury in the anterior shoulder. It's constant in the shoulder, intermittent in the arm, and in the scapular cervical spine. Considering all of that, what's on the table? Where are you leaning toward? And how are you structuring your worse, better section questioning to help you start funneling down on that provisional classification?
All right. So, Jason, I like to take things one step at a time. So if I take the top part of my assessment form where I think how old she is, the pain location to me is very distinct. I look at that and I think this is, Jason, that's either going to be cervical, even though she's tested this already. So this is either cervical. This is unlikely going to be contractile dysfunction, but keep in mind that the rotator cuff is a bit of a pain. There can be some referral, all right? There can be some referral. So can that be contractile dysfunction? That even that pain coming up here, there is some contractile tissue up here. I can't completely rule that out, but derangement is not ruled out either. So I'm stuck with cervical derangement at this stage, possible contractile dysfunction, and then I wish you didn't mention the slap lesion on MRI, because we all have our biases, and even that influences me a little bit. So you've always got that at the back of your mind. Is this going to be something that just won't respond to an assessment? So that was part of my thought. So keeping that in mind is basically building. So firstly, seeing if there's some positives with the worse, better section and the cervical screening. So think about, is there any paresthesia? All right, so that she said no to, so no paresthesia. Any pain and coughing or sneezing, which is also common, and there's a cervical derangement or an MUR, and again she says no. But following on that train of thought, turning your neck, is there any symptoms? Does neck movement affect this at all? And that's no, my neck movement doesn't involve this. Is also less and less that we're getting with regards to the cervical spine involvement. And here with worse better is you could literally ask the patient, so retraction, extension, what was the response to that? Any response whatsoever? Do you find that when your shoulder is sore, that any neck movements become restricted? So a lot of times patients would tell you that, yes, when my shoulder is sore, I can't turn my neck as far to the side, even though it doesn't usually affect it. And patients would generally just associate that stiffness with muscular stiffness due to the shoulder pain. So those type of things help me think that the cervical spine is less of a suspect.
Mm-hmm.
All right. With regards to the rest of the questions, with derangements, if this was going to be a derangement, something that I could quickly spot the derangement pretending to be something else, there was going to be some inconsistency, saying that some mornings it's better, some mornings it's worse. I can sometimes blow dry my hair for longer periods of time, and then other times it's just 10 minutes. And again, she comes out very consistent here. So circling all that, reaching up above her head, saying there's no underlining, no inconsistency. It doesn't seem to vary between days. So again, in my mind, with those type of answers that I'm getting, I'm thinking, not as likely derangement with a referral, so maybe contractile dysfunction.
Month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.